अस्सलाम वालेकुम dear students. इस previous session में हमने different methods of assessment discuss की in the undergraduate students of health sciences regarding how to assess their clinical knowledge as in the two form, that is in the cognitive form, which means the assessing the cognitive domain, as well as we discuss different assessment tool as well, how to check the practical skill, the different competencies of the undergraduate students. The most commonly used in Pakistan about the assessment tool for the assessing the cognitive domain is the multiple choice question. So today we are going to discuss in detail about the multiple choice question. मल्टीपल चॉइस क्वेश्चन जो है ये जितना उसका बनाना आसान होता है उतना जो है इसमें गलतियां भी ज्यादा होती हैं, इसलिए हम इस बात की जो है अपोजिट जाएंगे कि इट टेक लॉट्स ऑफ टाइम इन कंस्ट्रक्टिंग a strong, a quality and effective MCQ. एस अगर हम इसको टाइम नहीं देंगे तो फिर इस तरह के एमसीक्यूज बन सकते हैं, जैसे फॉर एग्जांपल इफ आई आस्क यू दैट आर मल्टीपल चॉइस एग्जाम्स एन एक्यूरेट मेजर ऑफ वंस नॉलेज, सो योर आंसर इज यस, is your answer is A and C, your answer is A and B, and all of the above. So obviously there is one of the biggest mistake in this MCQ that all of the options are correct and not a single option is correct, and we can say that the other are distractors also. That's why we are going to assess the different pathologies, the mistakes, flaws in the multiple choice question. At the end of this presentation, all the audience, they will be able to discuss the types of MCQs. They will be able to describe the anatomy of MCQ, what are the different components of an MCQ, what are the different pathologies of the MCQs. It means what are the different mistakes most commonly examiners, the teachers, they do while constructing the multiple choice questions. Then we will discuss the management to these MCQ pathologies, how we can work and to eliminate and to reduce the chances of those mistakes. And then we will discuss the technical flaws which are very common to MCQ along with examples. And then at the end, we will discuss how we can develop a well-structured MCQ testing appropriate content. So before going to that detail of MCQ, let's discuss the background of the assessment of MCQ. As we discussed in the previous session in detail about the Miller's pyramid, so I will not go in detail, but I will just recap the facts that according to the Miller prism of clinical competence, which is also known as the Miller pyramid, there are 4 categories in which 2 of them they are related to the cognitive domain and 2 of them they are with the practical skills. Yeah, we can say that the behavior, affective, and the psychomotor domain. And all these 4 different categories, they assess the different levels of knowledge, skills, and attitude. And as the one go from junior to senior classes, they just move from the nose, then to knows how, and then shows and does. Actually, the last, which is the does, which is in the top of this pyramid, this is actually when they do practice in the real life experience, when they do the practice, when they do the different procedure on the real patients. So the nose and the knows how, these are the 2 components categories which can be assessed through different types of MCQs. We can call as the true false, as is like the case presentation, short essay question, the long essay question, or the EMQ, which we can call as the extended matching question, or the extended matching item, or extended matching type of MCQs. While the other 2, which is the shows and does, they are mostly the shows that is via simulation and OSCE, And that's why in the next session we will discuss in detail about what are the different procedures, what are in detail about the ASCII. And the last one, which is the does, we will also discuss in the next session, inshallah, about the workplace based assessment, which is actually the assessment of the trainees, assessment of those residents when they are working in hospital under the supervision of a senior clinician. And so how we can the that senior faculty member or the supervisor, they can have the workplace based assessment. So, among all these assessment tools, we will discuss today in detail about the multiple choice question, which is used to cover the assessment of the knows and as well as the knows how. And then we will discuss the assessment method OSCE or OSP, which we used to assess the show's category of the Miller's pyramid. So, at the same facts about the Miller pyramid, that the nose, they usually have the factual test, and that's why they MCQ essay type or oral vivas they can be used to assess this category, while the MCQ essay type and oral viva same like they can be used to nose how, and then the OSPs and the others they can be used to assess the shows how or the test. So multiple choice questions, they are the single best answer. They can be the true, false, or they can be the extending matching item, which are known as the EMI, are also known as the extending matching question, shortly known as the EMQ. Similarly, there are other question as well, which is the modified essay question and the short answer question. Or all these are the different assessment tool used to check the cognitive domain, as we discussed in the previous that in this session, our main focus, our emphasis will be that mostly on the MCQ or multiple choice question. So the multiple choice question format, that may be the one best answer question, which may be A type, which single known is the SBA, the single best answer question, or that may be the R type or EMQ, which in which they are the extended match question. We will discuss the example of the EMQ or the R type. The multiple choice question, which we can call as the objective questions, there may be the true false question, and the true false question are again divided into two types. That is the standard true false type, or they can another type of the true false question is the K type complex true false question. These are also known as the complex question. Um, what we mean by the K type, which is also known as the multiple responses true false. Suppose there is a question that I will just give an example of which of the following they are the name of the province of Pakistan. So here is the Peshawar, this is the Punjab, that is the Balochistan and Karachi. Now, two answers are true and two are false, and the instruction are that write true or false to each option, to each response. For example, the first answer that was the suppose Peshawar. So it's not a province of Pakistan, so write false. The correct answer will be false. The next is the Punjab. So it is a province of Pakistan, so true will be written in front of it, the correct answer. Similarly, the C option was Sin, which is again a province, so that is true, and the other one was suppose it's Karachi or some other city, that is false. So it means the K type or complex true false question are those in which each response, each option in that question, that should be marked as false or true. But in nowadays examination, these both the standard true false type or the K type complex true false, they are not used so commonly. Standard true false type mean in which you have to select one among that which of the following is the true option, suppose. So that is the true options, and another thing, there will be a statement and there are two options, true or false, and you have to decide the statement is true or the statement is false. So you have to select T or F for that statement. This is actually the standard true false question. But if we have like a question that which of the following statement is true. Yeah, which of the followings, all of the following, they are false and except one. So these are true or false, but actually you have to select one best answer from the following. So that true false is actually not actual true false. That is a type of the SBA, which is the single best answer. But as we are not going to have these in our exam nowadays in the undergraduate level, so that's why we will not discuss the true false in detail, and our topic, our emphasis most will be on the different types of the MCQs, the multiple choice question. Either there may be the A type or there may be the R type. Why we should use the MCQ in our assessments? What are the benefits, advantages of the MCQ? These are through the MCQ, a broad and a high variety of content that can be assessed, as many questions can be asked in a single hour. So that's why a lot of content from various topics, from various themes, that can be assessed in a so short time. It's very effective as it contributes to very high validity and reliability per hour of testing time. And that's why this is one of the reason why MCQ they are used in most of the competitive exams. Similarly, this is objective nature and which help in the improvement and enhancement in the reliability of these assessment tools. That is the defensibility. Again, that is one of that advantages of the MCQ or the other assessment tools. They are accurate as only one option is correct, and the rating or the marking of such questions that is not only easy but as well it's very precise and accurate, and the results they are uh, being provided to the students in a very short time, as the marking, not only the uh, solution by the assessment time is short, but the marking duration is also too short, and that's why the feedback is very quickly given and time to the students. And secure reuse of the banked items. And nowadays, this is in different universities. They are having thousands of MCQ relevant to a single subjects, and when they are constructing a paper, so they just select randomly 50 MCQs, 70 MCQs, 100 MCQs, depend on the format of the that paper, the structure of that paper. So that is one of the the benefits, that a lot of questions that can be stored, and then randomly selection can make reduce the biasness of those questions. Cost effective, that is, we have detailed discussion about these, how it is cost effective, as there is no a lot of paper required for the solution. The marking is very easy, and there is no need of any expert for the marking of these MCQ. Even a person which is not relevant to that subject can easily check the MCQ if he or she is provided with the answer key, and that is the reason they can be marked in a very short time. So not only the human resources they are less required, but as well as it's a less time consuming, and that is the reason the MCQ as assessment tool is a very cost effective, and that is the reason most of the university exams, just because of all these benefits, MCQ is the most commonly used assessment tool for assessing the knowledge of the undergraduate students. Similarly, the MCQ, the high order thinking skills, they can be measurable through the MCQ, but there is some cases in that if that is properly formatted, if it is properly constructed, then we can also check, we can also assess the complex scenarios, the clinical scenarios through the MCQ. One fact, some people thinking that MCQ can be used just to assess the bigger facts or the simple facts, and it is not a suitable and not a proper assessment tool for assessing the clinical skills and the complex concepts of the student. But if they are properly constructed, these MCQs they can be used to assess the clinical abilities, the clinical scenarios, the complex concepts of any subject or any theme or any topic. Similarly, as there are a lot of benefits of MCQ, on the other hand, there are some weak points which we can say that which that describe the disadvantages of the MCQ, and that is the resource intensive, required skill to and time to write, especially context-rich question. What are context-rich question? We are going to discuss in the upcoming slides. But as context-rich question, they can be used to assess the deeper knowledge, the complex, the clinical skills, the clinical scenarios, the abilities, but that require the proper training of the teachers, that require to have a proper skills of how to construct proper MCQ, as well as there's a time consuming not only simple MCQ, that for example what how many types of the epithelium are. So that's very simple there, and the formatting and construction of such interview that does not require a lot of time. So, but on the other hand, if there is a clinical divinity, then obviously that required not only huge time, but it also require proper skill and proper training. Often used to test recall of facts, trivialization. Trivialization mean those questions they are asked which are less important, which having no such big role, which have a less component weightage in the curriculum. Another disadvantage of the MCQ is that there may be repetition of the question as well. The same question, the same concept, when it is asked in different words, in different structure, a sentence may be different, but the concept behind that question is similar, and that is often used to test a recall of facts, or simply we can use there may be repetition of the different concepts. Some facts which are the recall, they can be used, but that's very simple, and that may have some repetition of the again and again asking the same question. The MCQ promotes surface learning in students if used to test primary recall. Similarly, it also affects the strategy of the study, and as well as the preparation strategies of the student, as the students are already known to the fact that which ones they can be easily asked, there can be the component, there can be a question in the MCQ format. So that's why these type of assessment they promote the surface learning in students, and that is one of the drawback, that it reduces the power of their critical thinking in the students, because they are learning, they just study for the MCQ format, and there is no essay type question. So obviously, strategy for the study and the preparation that changes according to the MCQ. These MCQ assessment that also promote trivialization, which again we can discuss that trivialization mean asking questions which are not important, which have less weightage, and they are received more weightage, or they are asked again and again. So that is mean the trivialization mean asking the less important question, and avoidance of important areas and cognitive skills among item writers faced with difficulty in writing. Similarly, MCQ, they are not able to assist summarizing and writing skills, and that's why it can't be used to assist the critical thinking process, and the MCQ that reduces the ability of that critical and deep thinking, and formulating the essay answer, formulating a detailed answer, constructing a detailed answer to the question. So it reduces that capability and competency of the student. Similarly, bad public relations. Most of the students they may carry higher marks just because they have a good guessing nature, and some may have a lot of the different facts other than understanding the in depth of that concept. So they don't know what actually that means, but they just to memorize the facts, and which are and obviously they will carry the higher marks. And that is one of the point that MCQ that is not a best point for in that aspect. But if we look at all the other aspects, still it is we can say that it is much better than other, uh, and that's why it is most commonly used in the university level. So what are the structure, or we can say that the anatomy of the A-type MCQ? So we will take the example of this bunch of grapes just to understand the anatomy and the different parts of the A-type MCQ, which we can also call as the SBA, a single best answer. So this is the complete question with all its answer. That is the which means the cordon that is the large stem of the grapes, from which the small stems they are then originated, and then the bunch of that grape that is attached to the small stem. So all those small stem they are united to a large stem which is known as the cordon. So that cordon is actually the stem of the MCQ, the main detail of that question. Then, in the end, a short question is asked, which is actually known as the leading question. And then, after the leading question, there will be a bunch of options, a number of options. These options that may be three, there may be four, there may be five. Most commonly, they are used in the four format, or somewhere that may be up to the E, that A, B, C, D, five option. And this completely that is known as an item. Each MCQ that we can call as an item. And among these different options, there one is maybe the A, maybe the C, maybe the D, or maybe the E. There is no such rule that, um, but it should be randomly. The answer should be somewhere it may be the A, somewhere it may be the B's, because it will again um, decrease the biasness of that assessment tool. So among them, one option is correct, and all other options are incorrect, which are known as the distractors. Suppose this is a question, the question is the acronym ISD represents. Now this is the known as the stem of the question. So we have discussed in the previous slide. This is actually the stem of the question, that complete cordon and leading question, that is actually known as the stem of the question. Um, what is the leading question? Mostly when we that is the part of the context rich question, there is usually no need of the that leading question in the context free question. That simple statement is enough for that question. So this is the question stem. Then these are the options, and the acronym ISD is it is the acronym for the instructional system design. So this is the correct answer, and the ABC, these are the distractors and the correct, and these distractors options, they all are the different responses are the option. For example, there is a vanity, or we can say that a scenario. Um, and then it is a leading question. These are the options. So the question, the stem is like should be the history of that patient. There should be the detail and background info, and these info and background knowledge and history will help the student to answer that leading question. So the vanity is a wrestler visit a physical therapy clinic with complaint of the global shoulder pain. On examination, it was revealed that the pain is activity related. On objective examination, there was positive ear gastrointestinal test and pain with lift up test. So the two tests were positive, the ear gastrointestinal test and the lift up test were positive, and it was the activity related pain. So the leading, this is actually that unit here, we can say that the stem of that scenario. The leading question is based on these information. The students, they are asked that what is the possible etiology. So this is the leading question. And then the options, they are the subluxing long head of the bicep with partial subscapular tear. That is maybe the slap region, which simply means the superior labrum interior posterior region. The interior instability are the infraspinatus tear. So among these four options, three of them there should be the distractors, and one should be the correct answer, and the correct option is the that A, which is the subluxing long head of the bicep and with parts of subscapular tear. Now, MCQs, as we discussed previously, they may be of two types: the context free or the context rich. If there is no need of any detail in the background, there is no need of any detail to understand the leading question, and then that will be known as the context free. Like the example is the mechanism of posterior shoulder dislocation is. So students have to select that correct mechanism from the following, that is the abduction and internal rotation, elevation and external rotation, elevation of the shoulder and internal rotation, and abduction of the shoulder and external rotation of the shoulder. So they have to select the correct mechanism. There is no need of any detail about um, in this question. This question can be converted into a context-based question in which the students they are just informed what actually the posterior shoulder dislocation is, and then the question is the mechanism of the posterior shoulder dislocation is, but that is not mandatory, and there is no need of asking and giving that information related to the shoulder dislocation, posterior shoulder dislocation. On the other hand, if we, the teachers or we, the examiners, we want to assess the in-depth concepts of our students, we are going to check the clinical skills, the competencies, or clinical knowledge of our students related to a problem, related to a diagnosis, related to management, related to differential diagnosis or therapy and a different investigation. Then the context-rich question should be used. Context-rich mean in which there is a lot of information. A lot of information mean that may be briefly discussed, but enough information should be there to answer that question. For example, the question is a patient lying in supine on the treatment bed. So that is actually the position of the patient. So their scapula is stabilized with the arm by the side. You, as examiner, then take the glenohumeral to 10 degree of extension. Apply extensive rotation of the end of branch. At that point, move the shoulder into 45 degrees of abduction and then apply an intermediate light in the plane of scapula. This procedure is regarding assessment of which ligament of shoulder. So up to that point, the scapula, the student will have to read that information, and on the basis of these information, the students will be then decide either this description is about the assessment, the examination of which of the ligament of the shoulder. So the students either they will select the superior glenohumeral ligament, the coracohumeral ligament, the middle glenohumeral ligament, and the inferior glenohumeral ligament. One important thing, which is as we will also discuss in the technical flaws of the in the upcoming slide, but here it should be also be discussed as it is relevant to this point. In the context rate questions, the answer should be homogeneous. What does it mean by homogeneous? So what we mean, it means that all the options should be relevant to each other. If there is the procedure regarding assessment of which structure of the shoulder, so suppose in that form all the structures should be muscles, all the structure should be ligaments, all the structure should be nerves, all the structure should be tendon, there may be disc, there may be anything, but there should be no heterogeneity like superior glenohumeral ligament, bicep muscle. This is the medial nerve and the radial nerve. Up two of them are the nerves. One is the muscle, the other is the ligament. So obviously, the student will decide that the above process is not related to any nerve, that is not related to any muscle. So obviously, this is the superior glenohumeral ligament. So that's why end contest expression, the options which we are given, there should be homogeneous. Once there was a paper in the fifth semester of Doctor of Physical Therapy, and the paper was pathology, and that the options were like this. Suppose the question is the pathology is the scientific study of dash. So the responses were Monday, Tuesday, Thursday, and disease. So obviously, Monday, Tuesday, and Thursday, they are not relevant to that question. So the answer is obviously the disease. And all the questions in that paper were like, I don't know, might be the paper was leaked, and there may be some emergency, and the paper was just made in a single hour. So that's why proper timing is necessary for the constructing proper MCQs. And all the options, the three options were like in different colors, like red, blue, and yellow. They were just like January, February, March. They were like this name of cities, name of countries, and the one answer, one option that were relevant to the question, which was the correct answer. So there should be kept in mind that the responses are the options that should be homogeneous in specifically in the context rich question. Like if we that may be also homogeneous in the above context free option, there are abduction and internal rotation. All the options they are the moment and the true moments and the actual real moments of the shoulder joints. These are the combination of the two. One is the that strap movement, that may be the coronal plane movement, which is actually the abduction and adduction. One is the sagittal plane movement, which is the elevation, and then it is combined with a rotatory component, which may be the internal rotation or the external rotation. So there is homogeneity in the options, and that will actually then check the real assessment of the students. They will check the real assessment of their concepts. This is another question, which is the context question. And if we check the answers again, there is homogeneity, all of them, they are the different diseases, the different disorders which are relevant to the lower limb. That is the acute hamstring injury, that is the piriformis syndrome, that is the medial meniscal injury, that is the proximal gastrocnemius strain. All these are the related to the MSK, which are the muscles which are related to tendons, except there is one which is the medial meniscal injury, but the main focus is on the diagnosis. So all these are the different disorders of the lower limb. So in this again in this question, there is a detail of the patient. There is a vanity information of the both the objective examination, subjective examination is there, and then the students will read and will understand and will correlate all these information. They will integrate all the information and will decide that which of the following injury is most going to fit with all these information. So these live questions, there should be the part of question, and as the students are in the first year, in the second year, in the third year, or in the fourth or final year, such questions should be the part of the every level, regardless of in which year they are. But during the construction of paper, there should be a proportion of the easy question, the proportion of the image, the intermediate, or the proportion of the similar proportion and equal proportion of the difficult questions. Similarly, some questions should be context rich and some questions should be context free, and that will be a proper balance paper. Now the context-free and the context-rich question, there may be text alone or there may be text along with some illustration. An example of the context-free text alone question is the term sarcolemma refers to which component of a muscle cell. So this is the actin, cytoplasm, endoplasmic reticulum, membrane, and myosin. And all the options, they are the parts of the cell. So there is homogeneity. Similarly, there is a picture given along with the question, and then a question is asked relevant and regarding that image, that figure, that which type of epithelium is shown in this diagram. Either that is the cuboidal columnar epithelium or the pseudostratified epithelium, that is the squamous epithelium, or the transitional epithelium. We can see that the number of options is 5. So we have discussed previously that most commonly there are 4 or 5 Similarly, the context, there are two context-rich question, but one is the text on and the other is the um, illustrated plus test. There is an image of the cell of the white blood cell, and then they have asked a question relevant to that image. So that means the context, the MCQ may be the context rich or maybe the context free, and then these both type of MCQ, they may be text alone or they may be the combo of the both illustration and text. Some MCQs, they are having options which are all correct, but then the weightage should be given to the correctness of these options. Some of them, they are too much and they have a higher percentage of the that correctness, and others are also correct, but they have less percentage of that rightfulness. So, for example, there are five options, and all of them are the correct, but one is the most correct answer, and the other are the least correct answer. Such questions, they are known as the ranked order options. Are they? That is a type of best answer item, and so in some literature, these questions, they are also known as the BCQs, which are known as the best choice questions. It means all of the options are true, but they have to select the best option among these true options. So these are actually the best choice question. And here in the responses, there is a high level of homogeneity, and even the students which having that rata or memorization strategy of study, they are mostly have problem understanding, and there may be the high chances of confusion to students. So such best choice question, the BCQ, they're the best as compared to the other option, in which there is very clear understanding that these are the distractors and this one is the correct option. So these are the EMQ, which are the extended matching question, also known as the extending matching item, shortly known as the EMI. These are like the single best answer, but they are in the upside down structure. Like there is a theme of the top theme is written, then the options are written, and these option, unlike the single best answer, they were uh, four or five, but here in the extended matching question, the number may be more than 10, there may be 12, there may be 8, there may be 15, there may be 12. So there is no such big rule that there will be 6, 8, 10, 15, but mostly the options, they are more than 10. And then there is, after the options, there is leading question, and then there is 10. So what does it mean? The upside down in the SBA, the in the top of the question there was stem, and then there was leading question, and then there was option. But in the EMQ, there are the leading question, and there are option in the start. Then there are leading question, and then in the bottom of that question, there are the stem, or which we regard as the item. So this is the example of the EMQ, the extending matching question. Suppose the theme is fatigue, and the options there are the acute leukemia, anemia, chronic disease, congestive heart failure, depression, the EBV infection, the Epstein-Barr virus, the folate deficiency. And similarly, they are up to the N, which is the vitamin B12 deficiency. So there are many options from A to N, and then there is a leading question for each patient with fatigue. Select the most likely diagnosis for the following stems. So there are two options. Again, this is like Vinity, which we discussed in the context-rich single best answer question. Um, there is detail of a patient. Just for example, in this question, a 19-year-old woman had fatigue. As the theme is fatigue, so these both vinities, they should be relevant to the fatigue topic. So they have fever and they have fatigue as well as sore throat. They are also having the cervical lymphadenopathy. It means there is swelling of the lymph nodes of the cervical. They are the splenomegaly. and different investigations. Then there is T test, which is the aspirate amine transferase test, different. And on the basis of all these information, data which is being gathered by the that subject to an objective examination, what is the possible diagnosis among these options? So the student have to select an answer from A to N for the STEM 1, and in this example, the answer is E, Epstein-Barr virus infection. And we can say that as in the EBV infection, usually the swelling of the nodes, specifically the interior cervical lymph nodes, they are very common in them. So that may be the correct answer. Similarly, there is another vanity as well, in which there is a 15-year-old girl has a 2 week of eastern fatigue and back pain, and then there is a decline in their blood count, in the platelets, in the RBC, in the hemoglobin. And the best of these information, answer is from any one of these from A to N, and student have to select one from them, and the best option is that acute leukemia. So it means in the EMQ, the extended matching question, there may be depending on the streams, there may be three, there may be two, there may be four, and all of them, the answer would be from the list which is being given in the top of that question. So this is just upside down from the SBA. The SBA question that is include of that stem. Then there is a leading question and then the option. While the extending matching question, the initially they are having the options. Then there is leading question and then there is a stem. So the rules for writing the general rules, the two rules we will discuss in the next session for the MCQ, inshallah. Thank you so much to all of you.